The debate over the future of Medicaid explained. Medicaid is the popular joint federal and state insurance program that helps cover medical costs for 72 million poorer Americans. Cuts to the program seem all but certain after the Senate released a framework for their version of what President Trump calls the Big Beautiful Bill. The Senate's bill calls for even steeper cuts than the House version that passed last month. Republicans say they're not cutting Medicaid, they're going after waste, fraud, and abuse.
If you find waste or fraud or abuse, we want to strengthen Medicaid.
While Democrats are united in their opposition to Medicaid changes, some Republican senators have expressed concern as well, particularly over the impact on rural health care.
Half of the hospitals in the state rural. I grew up in a town of 4,000 people. I've lived this. No, this is a problem. This is why I say this bill needs work.
Two new reports detail the potential harm from a loss of Medicaid funds. A report from the American Hospital Association estimates the House bill would result in 1.8 million individuals in rural communities losing their medical coverage and result in a $50.4 billion reduction in federal Medicaid spending on rural hospitals over 10 years. The nonpartisan Sheps Center for Health Services Research saying hospitals may be forced to reduce service lines, convert to a different type of healthcare facility, or close altogether. Two controversial aspects of the bill are work requirements and provider taxes. The main clause of the House bill's work requirement calls for states to condition eligibility for those ages 19 to 64 on showing they are working or taking part in qualifying activities like going to school. Republicans argue they're making sure able-bodied people are working if they want to receive Medicaid benefits. The other issue is provider taxes, which are a fairly complicated but legal maneuver having to do with reimbursement to hospitals from states. It has become integral to the Medicaid reimbursement system and raises millions of dollars for each state. But not everyone agrees with this tax maneuver.
The states have gamed the system for way too long, and we're fixing that. These provider taxes, if you actually were able to explain it to your viewers, they would look at this is insane. Why are the states doing this money laundering scheme?
The hospitals don't see it that way.
Don't call it money laundering and don't call it Medicaid fraud, because clearly it's not. It's a practice that's been acceptable since the 1980s. And if you want to address it, fine, address it. But don't label the people that are doing it legitimately as people that are committing Medicaid fraud.
The nonpartisan Congressional Budget Office estimates the House bill would increase the number of uninsured by almost 8 million, and over 10 million fewer people would be enrolled in Medicaid. Republicans argue their reforms will help save Medicaid.
We're going to reform it so that we can save it for the people that it's intended to support.
But healthcare professionals say Medicaid cuts can be more far-reaching.
If you take Medicaid away from those facilities, they could close. If they close, what does that mean for the people in that community? All of those residents need to find another place to be cared for, and those families now are going to be driving longer and longer distances to visit their loved ones.
The Senate continues to negotiate its version of the budget bill. If it passes, it will get sent to the House for a vote. Republicans have a goal of sending a final version to the president's desk by July 4th. This is Jackie Coppell for News Nation.